Welcome, you're watching Vox News, your daily evening news with Rita Kamkumo. President Alpha Conde's flagship project, the construction of the Swapiti Dam, considered the largest hydroelectric project in West Africa, is almost completed. However, Human Rights Watch accuses the Guinean government, in a new report released on Thursday, of trampling the rights of thousands of displaced people. According to the organization, villagers whose livelihoods are being destroyed in the process will have to relocate and lose everything, including their ancestral lands.
It was my ancestors who founded this village. We are going to leave a lot of things behind, like our plantations. We leave it for the development of Guinea.
If we had the choice, we wouldn't leave. But since the government tells us we will be relocated, we have to do it. Otherwise, we'd have liked to be buried on our lands next to our parents.
The villagers are patiently waiting for replacement land and adequate compensation from the government.
We were brought here, but they didn't show us where to farm. So how will we farm? We can't farm. How can the government help us?
The Swapiti Dam could tremendously improve access to electricity in the country. However, Human Rights Watch laments the fact that the 450 megawatt dam, which is part of China's Belt and Road Initiative, is being carried out at the expense of local communities who are also suffering from flooding.
The reservoir will flood a vast zone, home to dozens of villages, all of which must be relocated, and thousands of hectares of farmland will also be destroyed. The government of Guinea is happy to talk up the benefits that Suapiti's electricity will bring. But the government can and should do more to ensure that the project does not harm the communities most affected by it.
The construction of the project involved the most significant displacement of people in the country's history. Guinean authorities declared that the dam reservoir would eventually displace approximately 16,000 people from 101 villages and flood 253 square kilometers of land. The government started filling the reservoir a year ago, displacing 51 villages to prepare for rising flood waters. Villages should be resettled before this year's rainy season. In Cameroon, after a prolonged absence of several weeks, President Paul Biya made his first public reappearance on Thursday as part of an audience granted to the French ambassador in Cameroon, Christophe Guilloux, which took place in Yaoundé. The Cameroonian head of state announced on social media that he had received the ambassador at the Unity Palace. On the picture posted on his Twitter account, President Biya, who appeared without his mask, added that the two had discussed the management of the COVID-19 pandemic in Cameroon, France and the world. In Nigeria, 14 people died on Thursday in a fire that broke out in a camp housing about 70,000 displaced people who fled the violence of the jihadist group Boko Haram in the northeast of the country.
There was a fire incident in one location, and our team that are on ground really responded timely, and they received the report. They sent a report, and I received immediately. You know, when such things happen, we have to ascertain location, casualties. If we get details, then the state emergency management will respond appropriately.
According to Umar Kashala, the head of a pro-government militia in the region, the fire broke out in the morning in this camp located in the city of Gamburu in Borno State, near the border with Cameroon. More than 200 precarious shelters were destroyed by the fire, leaving 1,200 people without roofs. The causes of the fire are still undetermined. Since 2009, the conflict with Boko Haram has forced nearly 2 million people to flee their homes in northeastern Nigeria and killed 36,000. In Mozambique, a court rejected the claim for compensation made by the family of Anastasio Matavele, a civil society figure whose murder by police officers before the October 2019 general elections had caused a stir in the country. The head of the NGO Center for Democracy and Development, Adriano Nuvunga, deplored on Thursday a denial of justice and said that those who killed him wore police uniforms. He described the court's decision as a state crime. The 58-year-old man, former head of a forum of associations, was shot dead on the 7th of October last year by armed men while driving in the city of Zeze. As they were fleeing, his alleged attackers were involved in a car accident in which 2 of them died. Police headquarters had announced the day after the murder that 4 of them were agents of a local police intervention unit. The head of the unit, Tudelo Guirido, suspended after the murder, was arrested a few weeks later. While awaiting their trial, scheduled in May, the lawyer of the victim's family claimed damages of about $520,000 from the state. However, the court rejected the family's request on the 8th of April because the alleged killers were not in service at the moment of the assassination. Former Algerian Minister of Foreign Affairs Ramtan Lamamra officially announced on Thursday that he would not apply for the UN envoy to Libya position after the US refused to endorse his candidacy. Mr. Lamamra explained in a statement to the Algerian press that he intends to call within the next few hours the UN Secretary-General, Antonio Guterres, to inform him of the withdrawal of his candidacy. The head of the UN is already looking for another personality as a replacement. The Algerian diplomat was expected to replace the UN Special Envoy to Libya, Ghassan Salamé, who resigned. Alger warned other countries using the Lamamra case to attack its diplomacy. The World Health Organization's regional director for Africa, Dr. Matshidiso Moeti, warned on Thursday that Donald Trump's decision to withhold funding could have a significant impact on the continent's fight against coronavirus.
The US government is an important partner, not only in financial terms, but also it's an important strategic partner. We work with many of the technical institutions in the US. They're important players in WHO's policy making, strategy making, and we value the relationship with the United States. The impact potentially of this decision will be quite significant on areas such as polio eradication. We're on the way to having a declaration of certification of polio being eradicated from Africa. The US is one of the biggest supporters of that.
Dr. Matshidiso Moeti also discussed the efficiency of confinement measures among African populations.
There is no doubt that social distancing is difficult in some settings, extremely difficult, and perhaps especially when we consider that component of asking people to stay indoors and not go out in some settings in the ways in which people are living is simply not going to be possible. And if we take into account the size of dwellings, the size of families.
Dr. Moeti called for more clinical testing to be conducted on the continent. Insurrection in Malawi as small shopkeepers denounced on Thursday the containment measures imposed from Saturday by authorities to stem the coronavirus pandemic. They warned the government that they will not respect the lockdown for survival's sake. President Peter Mutharika has ordered the population to stay at home from Saturday and for at least 3 weeks. However, informal sellers indicated that they will not obey the lockdown order. Several thousand of them marched on Thursday in the streets of Mzuzu against the confinement order, according to the municipality spokesman, MacDonald Gondwy. Moreover, an influential civil society organization announced its intention to challenge the presidential order before the courts because it is not accompanied by any measures to compensate the most vulnerable populations. In Nigeria, health authorities have started community-based COVID-19 screening to identify carriers to prevent the spread of the virus.
We have come for active case search of COVID-19 in the communities, and we've started this for the past 2-3 days. So we're trying to see that to ensure that there's no community transmission, and if there is, for us to detect it and start other treatment.
Communities. Initially, we've been going to the communities, awareness, creation, sensitization. So it's decided now, let's just go to them, take their samples, we take their data. Anybody that is positive, we call him, we go to him, we pick him and take him to the isolation center. Treatment is free, feeding is free. That's why we're here today.
Health workers have been deployed to satellite cities, villages and suburbs in the capital city Abuja to conduct tests and raise awareness about the new coronavirus.
The father and the son in Lugbe that were discovered, they called and we took their sample. We found that it's the father and his son, who was 7 months old. So we took them to Gwagwalada Hospital and they are responding to treatment right now.
At least it will give me boldness to say that there's nothing wrong with me and to be more careful how I stay close to people or the people I allow coming around me. So that is why I'm here.
With nearly 200 million inhabitants, so far Nigeria has conducted around 6,000 tests throughout the country. The African Union Center for Disease Control and Prevention plans to distribute 1 million COVID-19 screening tests on the continent starting next week, as announced on Thursday by its director, Dr. John Kengasong. The action is part of a new program called the COVID-19 Accelerating Testing Partnership. In many countries, the limited ability to conduct large-scale testing doesn't allow the authorities to have an accurate picture of the pandemic on their territory. Dr. John Kengasong added that in Ethiopia, a country of over 100 million people, the number of tests conducted currently amounts to 5,000 or 6,000 in Africa's most populated country, Nigeria. Although the millions of test kits that will be distributed are far from the needs of the continent, the program also aims, among other things, to increase the number of healthcare workers involved in finding contacts of coronavirus positive cases at the community level. The PACT also intends to draw up an accurate inventory of medical equipment on the continent. That's it for today. Thank you for watching Vox News.